Training topic: Prevention of Respiratory Diseases, latest CDC guidelines. Fighting respiratory viruses together. With the rise of respiratory viruses like influenza and COVID-19, it's more important than ever to take steps to prevent the spread of illness. By understanding how germs are transmitted and following key guidelines from organizations like the CDC, we can work together as a community to keep ourselves and others healthy. Strategies for prevention and community action. Respiratory viruses are highly contagious and can cause serious illness, hospitalizations, and even death. They are transmitted through respiratory droplets when an infected person coughs, sneezes, or talks, and can also be spread by touching contaminated surfaces. To protect ourselves and our communities from these viruses, it's essential to follow preventive measures and guidelines from health experts. Introduction to common respiratory viruses. Understanding the basics. Respiratory viruses are tiny germs that can cause infections in your nose, throat, and lungs. These infections can range from mild colds to serious illnesses. 3 widely recognized respiratory viruses are: 1. COVID-19, a novel virus that led to a global pandemic, causing symptoms like fever, cough, and difficulty breathing. It can severely affect the lungs and other parts of the body. 2. Influenza, flu, an infectious respiratory illness, with symptoms including fever, chills, muscle aches, cough, and fatigue. It comes around every year and can lead to severe health complications. 3. RSV, respiratory syncytial virus, commonly causes mild, cold-like symptoms, but can be serious for infants and elderly adults, leading to severe respiratory illness. Importance of awareness and prevention. Understanding these viruses is crucial for prevention. Simple steps like regular hand washing, staying home when sick, and getting vaccinated can significantly reduce the spread of these diseases. Awareness also helps in recognizing symptoms early and seeking timely medical care. How viruses spread. Viruses are tiny invaders that can make us sick, and they have clever ways of moving from one person to another. Here's how they manage to spread. 1. Through the air. When someone who's infected talks, coughs, or sneezes, they send out tiny droplets into the air. These droplets can carry viruses. If another person breathes in these droplets, they can get the virus too. This is called droplet infection. 2. Touching surfaces. Sometimes, these droplets land on things like door handles, phones, or tables. The virus can live on these surfaces for a while. If you touch one of these surfaces and then touch your face, you can pick up the virus. 3. Close contact. Being very close to someone who's infected can also spread the virus, especially through things like handshakes or hugs. 4. Indoors. Viruses spread more easily indoors, where air doesn't move around as much. This is why being in crowded places with poor ventilation can increase the risk of getting sick. 5. From animals to people. Some viruses start in animals and can be passed to humans. This doesn't happen with all viruses, but it's how some new viruses appear. Keeping germs away. Overview of CDC guidelines for prevention. Unified prevention strategy. The CDC advocates for a comprehensive strategy to combat respiratory diseases, emphasizing the importance of accessible and easy-to-follow guidelines. This unified approach aims to protect against various respiratory viruses through common preventive measures. By adhering to these guidelines, individuals can play a significant role in preventing the spread of respiratory viruses within their communities. The CDC's approach focuses on making prevention as straightforward and actionable as possible, encouraging wide adoption of these practices. Key guidelines include: 1. Vaccination. Stay updated with vaccinations available for respiratory diseases, like the flu and COVID-19. Vaccines are a primary defense mechanism in preventing severe illness. 2. Enhanced hygiene practices. Regular and thorough hand washing, using sanitizers, and avoiding touching the face with unwashed hands are emphasized as daily habits to curb the spread of viruses. 3. Improved indoor air quality. Ensuring proper ventilation in indoor spaces can help reduce virus particles in the air. This may involve using air purifiers or simply opening windows to allow fresh air circulation. 4. Mask wearing when necessary. In crowded or high-risk settings, wearing masks can provide an additional layer of protection, especially in areas with high transmission rates. 5. Isolation. When ill, isolating oneself when showing symptoms of a respiratory virus is critical to prevent passing it on to others. This includes staying home from work or school and avoiding public places. 6. Responsible etiquette. Covering coughs and sneezes with a tissue or elbow and disposing of tissues properly are practices that everyone should follow to minimize the spread of germs. By adhering to these guidelines, individuals can play a significant role in preventing the spread of respiratory viruses within their communities. The CDC's approach focuses on making prevention as straightforward and actionable as possible, encouraging wide adoption of these practices. Personal Protective Equipment, PPE, Use and Disposal, Training Manual for Home Healthcare Workers. PPE serves as a vital barrier between infectious agents and healthcare workers, offering protection during patient care activities. Its correct use is essential in preventing the spread of infections, safeguarding both caregivers and patients. Correct sequence for donning PPE. To maximize protection, PPE must be put on in the correct order. Here is the recommended sequence. 1. Hand hygiene. Clean your hands thoroughly with soap and water, or an alcohol-based hand sanitizer. 2. Gown. Wear the gown and secure all ties or Velcro fastenings. Ensure it covers your torso and the top of your arms. 3. Mask or respirator. Place over your nose, mouth, and chin, securing it snugly to minimize gaps. If using a respirator, perform a fit check according to the manufacturer's instructions. 4. Goggles or face shield, positioned to protect your eyes without obstructing vision. 5. Gloves. Pull them over the cuffs of the gown to cover your wrists fully. Avoid touching your face or adjusting PPE once applied, as this can lead to contamination. Fit and comfort. The effectiveness of PPE is significantly influenced by its fit and comfort. Ensure PPE, especially masks and gowns, fits well without restricting movement. Perform a fit check for masks to ensure a tight seal around the face. Safe removal and disposal. Removing PPE without contaminating yourself requires careful attention. 1. Gloves. Remove first to avoid contaminating your hands. Use the glove and glove or bird beak technique. 2. Gown. Untie ties or Velcro. Carefully pull the gown away from the body, folding or rolling it inside out. 3. Goggles/face shield. Handle by the headband or earpieces, avoiding the front. 4. Mask or respirator. Remove last, touching only the ties or elastic bands. Lean forward to let the mask fall away from your face. Perform hand hygiene immediately after removing each piece of PPE. Disposal and reuse. Dispose of single-use PPE items in designated biohazard containers. Reusable items like goggles and face shields should be cleaned with soap and water, then disinfected with an appropriate solution. Allow to air dry before reuse. Store reusable PPE in a clean, dry place after disinfection. Scenario-based training. Practice makes perfect. Regularly simulate scenarios you encounter in home care to hone your skills in applying and removing PPE correctly. Pay particular attention to regular patient visits requiring basic PPE, care scenarios involving patients with respiratory symptoms necessitating enhanced precautions. Common mistakes to avoid. Touching or adjusting PPE with contaminated gloves or hands. Incorrect sequence in donning or doffing PPE. Inadequate hand hygiene before and after PPE use. Continue to stay informed and follow CDC guidelines for the latest updates and developments in preventing the spread of respiratory viruses. Let's work together towards a healthier and safer future for all. Stay safe. Thank you.